beauty, welcome to Dr. Vibe's Learning Point. In this video, we'll study about the topic that is called as hypospadias. First of all, hypospadias का मतलब क्या होता है? So it is an abnormal ventral urethral opening. We know that normally the urethral opening in males is open at the tip of the penis. But if this opening is present ventrally on the penis or the perineum, then we called it as hypospadias. Hypo मतलब नीचे. So टिप की जगह पे वो जो ओपनिंग है वो पेनिस के नीचे प्रेजेंट है या फिर इट इज प्रेजेंट ऑन द पेरिनियम. So there's a classical triad of hypospadias which you should all remember. First, that there is proximal ventral urethral meatus. Okay. Second, the ventral penile curvature is what you can elicit properly. And third is there is a dorsally hooded prepuce. So एक ventral opening होता है, एक curvature होता है और एक hooded prepuce होता है. Now, why does hypospadias develop? इसका embryological basis है क्या? Let's see this in details. Now see on the screen, there is an endodermal penile urethral plate. Okay. Now what I'm showing you here is the normal formation of the urethral opening. And then we will see why does the hypospadias develop. Okay. So first there is an endodermal penile urethral plate. There will be ingrowth of this plate. And after this ingrowth, there will be complete fusion of this plate. Now suppose there is the failure of this complete fusion or the incomplete fusion of this in a endodermal penile growth plate will cause hypospadias. Okay. Now first acquaint yourself with this diagram. This shaft-like thing is the penis. This is the scrotum, which you can see as the W-shaped structure. Then you have the anal opening. Below the anal opening, or you can see the buttocks, and this is constitutes the perineum, right? Now I will show you what are the possibilities of this abnormal urethral opening. Normally you know that it is present at the tip of the penis. अब abnormal है तो कहाँ located होगा? See, first it can be present at the glans penis. So that is called as granular. उसके नीचे आप जाओगे, that will be coronal. Coronal के नीचे subcoronal, right? Then it can be distal penile. That means penis के shaft में present है. तो distal हो सकता है, वो mid हो सकता है, वो proximal हो सकता है. Okay? Then you can have it in the penoscrotal, मतलब scrotum के सामने penoscrotal. Then it can be scrotal and then it can be perineal. Perineal मतलब perineum में present होगा. So these are the possibilities of the urethral meatus. Now 1, 2, 3 मतलब ग्लैन्युलर, कोरोनल, सबकोरोनल को हम एंटीरियर बोलते हैं. जो भी शाफ्ट में प्रेजेंट होगा उसको हम मिडिल बोलते हैं. Which can be distal shaft, mid shaft और proximal shaft. और लास्ट को बोलते हैं proximal या posterior. Now, what are the problems that person can face? So, it can be cryptorchidism. It can be chordae can be present. A hooded prepuce can be present. Right? Now, what are the problems which young people have? So young people will have cosmetic problems and they will have poor streamed maceration of the perineal skin. और adult age में क्या होगा? Adult age में they will be difficult in the sexual relationships. Right? Now what is the treatment of hypospadias? So treatment is surgery. क्या क्या options हो सकता है? Meatoplasty हो सकता है, urethroplasty हो सकता है and orthoplasty हो सकता है. These are the surgical options for hypospadias. So, आज की वीडियो में हमने क्या क्या पढ़ा? हमने ये पढ़ा कि hypospadias क्या होता है, hypospadias का formation पढ़ा, what are the problems which people can face, we study about the classical triad of hypospadias, and finally, what surgery is to be done for the treatment of hypospadias.